ADHD test, take control of your ADHD diagnosis with self-assessment. While it may be commonly believed that ADD/ADHD diagnoses are always based on objective standards, this is often not the case. In many instances, the diagnosis and eventual medication of ADD/ADHD patients is based on a subjective process that I refer to as the diagnostic cycle. This cycle, which has the characteristics of a self-perpetuating vicious circle, often leads to patients being medicated without an accurate and thorough evaluation of their condition. The diagnostic cycle typically begins when a patient or their parent notices certain symptoms, such as difficulty paying attention or impulsiveness, and brings these concerns to a healthcare provider. The provider may then administer a subjective assessment, such as a checklist of common ADHD symptoms, to determine if the patient meets the criteria for an ADHD diagnosis. This assessment is often based on the provider's personal experience and judgment, rather than objective, evidence-based criteria. If the patient is diagnosed with ADHD, they most likely will be prescribed medication. However, these medications can have significant side effects and may not be the most effective treatment for the patient. In addition, the subjectivity of the initial diagnosis means that many patients may be misdiagnosed and treated for a condition they do not have. The diagnostic cycle, with its reliance on subjective assessments and lack of objective criteria, can lead to patients being misdiagnosed and unnecessarily medicated. It is important for healthcare providers to be aware of this cycle, and to avoid relying solely on subjective assessments when diagnosing and treating patients with ADD/ADHD. To understand this vicious circle, we need to consider a few basic facts. 1. Most initial diagnoses take place at a relatively young age, with many children being diagnosed and medicated well before they reach their 10th birthday. 2. In most of these cases, the direct trigger that eventually leads to a diagnosis is behavior at school. Children starting school or who are changing school environments are especially likely to get caught up in this diagnostic cycle. 3. Teachers play a significant role in the referral of children to be evaluated for ADD/ADHD. What follows is not an attempt to demonize teachers. The vast majority of teachers are dedicated professionals who have the best interests of the children in their care at heart. It is, however, not difficult to work out why stressed and overworked teachers will embrace anything that they believe will create a better learning environment in their classrooms. Consider the following scenario: little Johnny goes to school for the first time. He is a very active boy who finds it hard to sit still for prolonged periods. He is also not used to highly structured environments with fixed behaviors and expectations. Johnny struggles to adapt to school, he fidgets a lot, daydreams frequently, and is generally high maintenance. His teacher realizes that she is spending a disproportionate amount of time trying to keep little Johnny in line, and that this investment of time is putting the rest of the class at a disadvantage. She knows from previous experience that there are drugs available that will help active, fidgety children to concentrate and sit still. She may not be sure there is anything neurologically wrong with Johnny, but she does know that the medicating of some previous students made them more compliant and less disruptive. Weighing up the needs of the many against the needs of one student, she decides to recommend that Johnny be evaluated by a doctor. It is at this stage of the process that serious questions need to be asked. It is certainly part of a teacher's duty of care to have a student evaluated if there are serious doubts about her ability to pay attention or adapt to the class environment. The problem is, however, that many referrals are framed in ways that may lead doctors to an ADD/ADHD diagnosis without seriously considering alternative explanations. If a teacher specifically refers a student for evaluation of ADD/ADHD, they are essentially asking a leading question that assumes the student has this condition. This type of referral can bias the evaluation process and may lead to a misdiagnosis or inappropriate treatment. By suggesting the possible presence of ADD/ADHD, the teacher almost guarantees that this will be the major avenue of investigation and that a diagnosis is likely to follow. This issue is compounded by the fact that some doctors can be counted on to diagnose nearly every patient with ADD/ADHD. It is not difficult to imagine that teachers, eager to create better learning environments, may steer problem students towards these doctors for a quick and easy diagnosis based on a paper test. In this way, the teacher effectively makes the diagnosis and receives confirmation from the medical professional, resulting in a dangerous and potentially harmful situation for the student. The diagnostic activities carried out by some teachers are made possible by the fact that accurately diagnosing ADD, ADHD is incredibly challenging. There is no foolproof, universally accepted method for making a reliable diagnosis. Instead, most professionals rely on highly subjective measurements to come to a conclusion. When you combine this subjectivity with the power of suggestion, as is often the case when a child is referred for evaluation of ADD/ADHD, it becomes very difficult for a child to avoid being labeled with this condition. This diagnostic cycle can have serious consequences for the child and their future. It is possible to break free from this cycle and avoid the potential dangers of unnecessary medication. By taking charge of the process and administering the tests yourself, without the pressure to arrive at a positive diagnosis, you can avoid being funneled towards medication. This approach allows you to make informed decisions about your own or your child's health and treatment. Doing the test yourself will help you to determine whether your child or you has a tendency towards ADD/ADHD. If this is indeed the case, it will be up to you to decide what the best course of action is. You will, in other words, be free from the relentless pressure to medicate that you would have experienced from the medical system. This freedom from pressure will allow you to follow a path that I am convinced is by far the best answer when it comes to the management of ADD/ADHD. Go to the source of the problem. Give your brain and body the building blocks it needs to overcome the condition by gaining focus and concentration. ADDhelpsite.com is dedicated to helping you achieve this. I hope that I have convinced you of the importance of self-testing for ADD/ADHD. By taking control of the evaluation process and administering the tests yourself, you can make informed decisions about your or your child's health without the pressure to conform to a certain outcome. I am happy to provide you with some tests to use. Please continue reading to learn more. Taking the tests. The following test can help you determine whether attention deficit disorder or attention deficit hyperactivity disorder may be a factor in the behavior of the person you are assessing. Please note, however, that this self-ADHD test is not meant to actually diagnose attention deficit disorder or attention deficit hyperactivity disorder. The simple fact is that there are no definitive lab tests or brain scans that can accurately diagnose ADHD. The American Psychiatric Association lists 14 behavioral checkpoints for an ADHD test, of which at least 8 symptoms must be present for a child to be officially classified as having attention deficit disorder, with or without hyperactivity. This means that the typical ADHD test checks for certain behaviors and characteristics that then form the basis of a diagnosis. The tests below expand the APA's 14 behavior checkpoints of hyperactivity and attention problems to produce a rounded view of a person's behavior and characteristics. A word of warning: the main problem with this method of diagnosis is that it can be highly subjective. The main reason for this is that people have different levels of tolerance for certain behaviors. What one person will experience and report as hyperactivity might be regarded and reported as normal behavior by the next person. Does all of this mean that ADD/ADHD tests are worthless? Self-administered tests for ADD/ADHD can still provide valuable information about a person's tendencies towards behaviors associated with this condition. However, it is important to avoid using these tests to reach definitive conclusions and base dangerous treatment decisions on them. This is a common problem in today's healthcare system. Taking the tests. The tests are quick, free, and easy to score. ADD/ADHD is a collection of behaviors and characteristics that all people exhibit to some extent. When conducting self-tests for ADD/ADHD, it is important to determine whether these behaviors fall within the normal range. One way to do this is to have multiple people, including the child if applicable, take the test and compare their results. This can provide a more well-rounded and balanced picture. Take the tests with an open mind and based on reality. Make sure that you reflect the way things are, not how you wish they were. Try to move beyond the mere analysis of behaviors themselves. Perhaps the most important question to ask in an ADD/ADHD test is if the child's hyperactivity, lack of enthusiasm towards school, poor grades, disruptive behavior, or other symptoms poses an obstacle to the child reaching his or her potential. It is important to remember that self-tests for ADD/ADHD are meant to help you or your child lead a fulfilling life. If the tests indicate a tendency towards ADD/ADHD, this should not be a cause for despair. There are many successful methods for managing and overcoming ADD/ADHD, such as the program offered at addhelpsite.com. Additionally, having ADD/ADHD can come with some benefits, such as the ability to hyper-focus and superior intelligence. The key is to understand your condition and make the most of it. We can help you do just that.